This is Heidi Gullett, and I'm a family and public health physician, and today I will be discussing the Institute of Medicine, rules and aims for health systems. There are multiple levels of any health system. A health system at large includes health care and also includes public health. So sometimes we speak of healthcare systems and sometimes we speak of the larger health system. I would like you to think of the health system as including both healthcare and public health systems. Next, you'll see that there are specific smaller systems that include different places where care is provided. So those can be hospitals, those can be clinics, those can be health departments, sometimes those are schools. And within each of these, it's important to remember that there's a culture of that organization, and there are different systems and processes in that very small area that function and really guide how care is provided. So there are overarching health system principles that we want you to understand. And then we want you to also understand that there are multiple places where care is provided on a much more microsystem level. And that's where you start learning about rapid cycle improvement, PDSA cycles, quality improvement techniques that happen within the clinic. They're equally important, but I want you to see how they fit together. So the National Academy of Medicine, formerly known as the Institute of Medicine, released aims and rules for healthcare systems. The aims are large overarching principles for that larger health system. We can apply them to our individual healthcare systems as well, but it's really important to understand what they mean. So that it is safe, effective, patient-centered, timely, efficient, and equitable. These are the principles that we would try to achieve in any health system, or specifically any health care system or any public health system. Care is best provided when we're able to achieve these aims. And you can see that we give you specific data elements in your team-based learning exercise to help you think through what kind of data would give you objective evidence that these particular aims are being met. Next, I've included the IOM rules for health systems. So these could be applied to the broader health system or specifically to elements of healthcare systems or the public health system. These are principles to achieve the best outcomes for our population and for the individuals who live in that population. So the first is care based on continuous healing relationships. Second is care that is customized to patient need and value. As you can see, we've addressed both of those in various IQ learning objectives throughout the block. The patient as the source of control. So this is a partnership, not necessarily a provider telling a patient what to do or a patient telling a provider what to do. The fourth is that knowledge is shared and information flows freely. You'll see another element of transparency mentioned on the next slide, but knowledge sharing and information flowing has an assumption of transparency at its core. And the fifth is that decision-making is evidence-based. This is why we ensure that you learn epi and biostats from the very beginning of medical school, and that you use EBIQ from the first year, from the second week of medical school in the first year, because you need to do this for your entire career to ensure that you're making the best informed care decisions alongside your patients. Next, you see the final 5 IOM rules for health systems. Safety is a system priority. Transparency is necessary and can be a catalyst for change on multiple levels. Needs are anticipated. You saw in the patient-centered medical home that there's an outreach to patients, systematically addressing population and individual health needs. So there's a high degree of anticipation. Waste is continuously decreased. You saw efficiency when you were looking at the aims. And cooperation is a priority, especially among clinicians. So you see the emphasis on interprofessionalism and the ability to work in teams is critically important.